Thank you for taking the time to watch this video regarding whether or not you qualified for integration. It's a complex question. It's not so simple to decide whether or not you are ready to integrate your center into a broader scope of practice. The very first concept that you'll have to consider, the first option, something that's a fundamental of the basis, will be, in this case, the philosophy, your philosophy. And that is, are you comfortable with your philosophy currently in your clinic? Broadening your scope of practice means bringing other type of services which will expand not only your current services, but will also give alternative treatment to your patients. You'll have to feel comfortable about that, knowing that some of those treatments may be, at this point, contraindicated for a philosophical standpoint. But if you're comfortable with that, and you're well anchored in your own philosophy as to what you do currently, integration will be essential, will be something that will be not only beneficial, but extremely popular with your patients. Second, you'll have to consider managerial concepts. In order to broaden that scope of practice, you'll have to bring in other practitioners. These other practitioners will have to, at all times, make sure that you are comfortable managing them. So, do you qualify? Ask yourself the question, are you a good manager? If you are a good manager, then this should be essential. If not, you'll want to make sure that you get trained on that by your consultant, or knowing the skills that you'll have to acquire to develop multidisciplinary clinics successfully. Something else that you'll have to consider is a certain amount of patience. We recommend, and I've been doing this for the last couple decades, since '94, so you can imagine the time. Hundreds of clinics, over 1,200 centers in 45 states. So I've always seen ups and downs, but really the good numbers are about 125 office visits per week, approximately 15 to 25 new patients per month. And you'll want at least a couple of years of experience, something that you've done, then it'll make you more comfortable and give you an advantage over other clinics. And it doesn't mean that if you don't have these numbers, you don't qualify. It just means that if you do not have these numbers, you'll have to make sure that somehow you make up in numbers what you lack in skills. Something to that nature so that you know what you're doing. Last but not least will have to be the fact that you are not only knowledgeable in the concept, but you'll be followed through in the developing the clinic, but you'll want to do that from a psychological standpoint. You have to want it. It does make a lot of money. There's no question the clinic offers many services, and there's no doubt, unequivocally, undoubtedly, that your clinic, by broadening its scope of practice, will bring in many more patients. Therefore, just by its very understanding, will make more revenues. More revenues mean more income. However, if this is at the price of shutting down your life, or choosing a path that you're not happy with, or taking an advantage of a system that you're not comfortable with, then it's not something you want to do. So if you want to know if you qualify and you have a question, call us. Give us a call. We'll answer some of your questions. We'll discuss it at greater length. One thing you want to make sure is that you want this. You are ready for that. That's how you know whether you're qualified. It should be something that you want. Because in life, it's not what you get that makes a difference. It's what you become. And Integrated Clinic could be a great center, something for you to look forward to. Thank you very much for taking the time. I'm Dr. Dahan. I'm the Senior Consultant with COA, and I appreciate your opportunity to speak. Thank you. Thank you for taking the time to watch this video. Feel free to check the other videos that we have also on YouTube. Please, if you don't mind, to like us on Facebook, follow us on Twitter, or connect with us on LinkedIn. We really would appreciate that. Thank you very much.